I anticipate and hope that phase 1 will start on Friday, May the 15th. Obviously, if our trends change, we will adjust that date as needed. While our tools to fight this virus have changed, our commitment has not. I want to reassure Virginians, we are not opening the floodgates here. We're not flipping a light switch from closed to open. When the time is right, we will turn a dimmer switch up just a notch. The reality is that the virus is still in our communities, and we need to continue our vigilance and social distancing, hand washing, and wearing of face protection when we're out and about. Our Forward Virginia plan has 3 phases. Today, I'm going to give more details on phase 1. As you will see, this plan will slowly and deliberately ease some of the restrictions, but not all. We will move forward cautiously with science, data, and safety as our criteria. First, I want Virginians to see what health data we're looking at to make these determinations. This is our confirmed positive cases by the date they were reported to the Virginia Department of Health. You'll see the blue bars represent the number of cases, and the yellow line is the 7-day moving average. While we've seen a slight dip in the past few days, largely these numbers are going up, and that is what we expect, in part because we are testing more people. But it's also important to remember that this virus is still out there. The next graph shows us how many people are being tested each day in the blue bars. The yellow line represents a 7-day moving average of how many people we are testing. As you can see, both the number of tests and the average of tests performed have both largely been trending upward. There may be dips where we have tested fewer people on one day, but overall, this shows that we are doing more testing, and we will continue to do more testing in the future. The next slide shows us how many of those tests came back positive. The dark blue graph is the number of people tested. The light blue at the bottom is how many were positive. And the yellow line, again, shows the average. I have said that I want a 14-day downward trend in the percent of positivity, and that is what we were seeing on this chart. Again, looking at that yellow line, see over the last 2+ weeks, that has been trending downward, and that's a good thing. The next slide shows how many hospitals are reporting shortages of PPE. The blue bars are the number of hospitals, and the yellow line is the 7-day moving average. This is trending downward, which is good news. It has been several days since any hospitals reported shortages of PPE. And some exciting news today. We, as you know, have ordered a PPE through several distributors, but yesterday we had a large shipment of PPE arrive from overseas. It was a 747 transport plane that landed at O'Hare Airport in Chicago, and we have trucks as we speak today that have been loading that PPE and are bringing it to Virginia. So that's something that we're very thankful and excited about. This next slide is what we're monitoring our hospital capacity. On this chart, the darkest blue at the bottom of how many COVID patients are in hospital beds. The medium blue is how many other patients are in beds, and the light blue is their staffed bed capacity. Now the yellow line, dotted line at the top, represents surge capacity. As you can see, our hospitals are currently reporting that they have capacity, and we'll keep an eye on that as elective surgeries continue to resume. The next chart shows us how many people who have COVID are hospitalized. The total number is the dark blue bar of hospitalizations, while the medium blue represents COVID patients in the ICU. And the light blue toward the bottom is COVID patients who are on ventilators. The yellow line is a 7-day average, and as you can see, that remains essentially flat, and that's a good sign. This next chart, as you can see, shows the rate at which our cases are doubling has slowed now to 16 days. So those are the data metrics that we're watching. Now let's talk about phase one. In many ways, it will look like what we've been doing. We will still encourage anyone who can telework to do so. The 10-person limit on gatherings will remain. We encourage everyone to wear face coverings when they are out and about around other people in the public. The stay-at-home order will become a safer at-home order. That means that while there are a few more places to go, everyone should still only go there as needed and otherwise stay home as much as possible. People who are more at risk due to age or health conditions should also still stay at home as much as possible. Everyone should keep up social distancing, staying 6 feet away from other people outside of their home. So here's what phase one will mean for the places that you go. Non-essential retail has been limited to just 10 people inside for 2 months in phase one. We will slightly increase that to 50% of the establishment's capacity. Restaurants, breweries, and beverage services have been limited to takeout, curbside, and delivery. That will remain for phase one, but if a restaurant or brewery already has a permit for outdoor seating, we will allow service in that outdoor area at 50% capacity. Entertainment and public amusement venues will remain closed in phase one. Gyms and fitness centers have been closed. In phase one, we'll allow outdoor classes with limitations. Beaches are currently open for only exercise and fishing. That will remain the case in phase one. Beaches at our state parks will remain open for exercise and fishing only, consistent with our public beaches. Looking forward, we are setting a high bar to ease beach restrictions. It will require a comprehensive and sustainable plan for cleaning, social distancing, education, and enforcement. Our faith communities play a special role in the lives of their members and in our communities. During the past 2 months, our places of worship have had a 10-person limit, with drive-in services allowed and encouraged. In phase one, drive-in services may continue, and services may be held inside at 50% capacity. Personal grooming services have been closed. They may open in phase one if they can adhere to strict social distancing with face masks required and appointments required. So the good news today is if all of this goes into effect a week from today, we can all get our hair cut by our barber or our hairstylist. Private campgrounds have been closed. In phase one, they may open with restrictions on distance between campsites. State parks have been open for day use only. In phase one, we'll slowly open for tent camping, RVs, and then cabins, and that won't happen immediately. I also want to remind Virginians that the 10-person limit continues to apply in state parks. Some child care centers have been open, prioritizing children of working families. That will continue in phase one. Overnight summer camps will remain closed in phase one. And again, the 10-person limit on gatherings will remain, and we strongly encourage teleworking for those able to do so, and wearing face coverings in public to protect ourselves and especially others. Here you can see all of this together. I know businesses will have many questions about the details of how this pertains to them. and all of the guidelines will be posted on our website, virginia.gov. When we enter Phase 1, we expect it will last a minimum of 2 weeks, and it may last longer, depending on what the data shows. A decision to move into Phase 2 will be based on health metrics like we are using for Phase 1. I know some communities may choose to go more slowly, particularly in Northern Virginia, where they may not feel their communities are ready to go to Phase 1 just yet. I have said that Phase 1 restrictions will be a floor, not a ceiling, and local governments should consult with our administration about stricter regulations. I want to emphasize that the business operations listed may open if they meet the requirements. If they're not able to meet these restrictions, they must remain closed. No business is required by the state to be open. I remind businesses that any reopening and a future economic recovery will be consumer-driven. I thank businesses for their cooperation and encourage them to take all the necessary measures for Virginians to feel comfortable and safe. That means taking precautions to protect everyone, including employees. Now I'd like to speak to our workers across Virginia. I understand that many workers at these businesses are eager to get back to work. But I also understand that there are workers who are afraid to go back right now because they or their loved ones have underlying health conditions or are part of vulnerable populations. I want to assure those workers we are going to do everything possible to protect you. The restrictions on business operations such as distancing and masks are meant to protect workers as much as customers. Yesterday, I spoke with our congressional delegation and asked them to take steps so that the federal government allows states more flexibility with unemployment benefits. I also want to assure Virginia's workers that if you feel your workplace is unsafe because it is not following the rules, please report that to our Department of Labor and Industry, also referred to as DOLI, and that they will investigate. We're also working to find every path forward for people who cannot return to work because of their own underlying health conditions or those of people that they live with. We will have more to say on this before entering Phase 1. I want to reiterate that our next steps are informed by our health data. I also want Virginians to continue to be careful and cautious. This virus is still with us. It has not gone away. It has no cure and no vaccination to date, and we may be living with it for months or even years. Our efforts have slowed the spread, but they have not cured the disease. I don't want people to let their guard down. When we move into this phase of easing restrictions, it will be even more important for people to behave cautiously, especially our most vulnerable populations, the elderly and those with underlying medical conditions. So please continue to be careful, wash your hands, cover your face if you sneeze or cough, and stay 6 feet away from other people in public. But at the same time, we know that there are things we cannot put off. Medical care is one of those things. We put elective surgeries on hold for 6 weeks, but those have been allowed to resume now that we have a steadier PPE supply. And I want to encourage Virginians to take care of their health. If you need to see a doctor or provider, please go. While we need to be careful of the coronavirus, we should not let illnesses or injuries go untreated. And as we talk about ramping up testing, I also want to remind Virginians that if you are ill or you have COVID symptoms, your doctor is able to determine if you need to be tested.